Hello, how are you? My name is Nadia. I'll be a nurse today. And can I have your name and date of birth? Okay, and what brings you in today, Miss Britton? Your annual exam? Okay, how you feeling today? Okay, great. So I'm gonna wash my hands. Do I have consent to perform the exam on you? Okay, I'm gonna provide you some privacy, okay? Pull your curtain back. All right, so here we have Miss Britton. She's a 21-year-old African American female. She's resting comfortably in examination chair, well groomed, no apparent distress, and well nourished. Having any pain at the moment? Okay, good. So we're gonna go ahead and get started, okay? So the first thing I'm going to do is start with inspection of your head, face. I'm gonna be assessing your skin, nails, and hair throughout the exam, okay? So I am inspecting head and face. Your face is round, it's symmetrical. Your color is appropriate for your ethnicity. It seems like you have a very beautiful head of hair, equal distribution, no balding, no alopecia, no infestations noted. I'm just palpating any pain or pressure. Noted. Great. Awesome. Alrighty. So I'm going to listen to your carotid arteries, and I'm going to be using a bell or the stethoscope, and I'm going to ask you to just slightly hold your breath for a few seconds, okay? Can you hold your breath for me? Okay, good. Breathe. It's 2 plus noted. 2 plus noted on the right as well. No thrills, no bruits noted. Okay, so I'm gonna start with palpating your sinuses, and you tell me if you feel any pain or pressure, okay? So frontal sinuses, any pain or pressure? Maxillary, any pain or pressure? Okay, so we're gonna move on to your lymph nodes, alrighty? So preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. No lymph nodes palpable at the moment. Okay. So now I'm going to assess your eyes. Okay. So I'm just inspecting. Can you open your eyes up for me? Okay. Lifting eyelids, lower lids, conjunctiva are pink and moist. Lacrimal apparatus also pink and moist. Sclera is white, and no corneal abrasions noted. Okay, so I'm also going to take a peek at your nose. Nose is symmetrical. Have any difficulty breathing? Is it harder to breathe on one side or the other? Okay, good. I'm just gonna look inside, okay? Can you tilt your head back for me? Okay, nasal mucosa, pink moist. No discharge noted. Septum is not deviated, it's medial. And no foreign objects noted in the nasal passages. Same, I'll get you to open your mouth for me. Can you open out? Stick your tongue out for me. I'll check those cranial nerves. Say ah. Can you wiggle your tongue side to side? Can you say light, tight, dynamite? Okay. Open for me one more time. Tonsils are 2 plus. mucosa is pink and moist, no dental caries noted, no lesions, no thrush. Can you lift up your tongue? Okay. No missing or chipped teeth. And no lesions or masses noted in the oral cavity. Alrighty. So as I'm checking your eyes, I want you to tell me when you see fingers moving, okay? Okay, great. I want you to follow my finger with just your eyes. So we're checking for equal ocular motor movements, okay, and accommodation. All right. Yep. Awesome. Okay, great. We're going to also check for your corneal light reflex and to see if your pupils are equal round reactive to light, okay? So let me hit this light for just a second. All right, so can I get you to cover one eye? It's your right one, cover that one. So, okay, we got direct response, equal, round and brisk. Uncover. Got consensual response. Cover that side for me. Direct response, equal, round and brisk. Uncover. And consensual response. So I want you to stare straight ahead for me, and I'm looking for your corneal light reflex, okay? And what I'm looking for is to make sure that the light basically shines equally in the same part of your eye when you're looking straight ahead, okay? Making sure we don't have any misalignment in your eyes. Awesome. I'm gonna turn the light back on, okay? All right, so we're gonna continue on checking those cranial nerves. Can I get you to raise your eyebrows? Close them real tight. Smile for me. Puff out your cheeks. Okay, good. Can you close your eyes for me? How's your sensation? Feel me touching? Does it feel the same on both sides? Feel me touching? Is it the same on both sides? Feel me touching? Same on both sides? Good. So I'm gonna check your temporal mandibular joint, that's your cranial nerve 5. So I want you to open your mouth. All right, we find a joint, close it. Can you move your jaw side to side? Can you do a little protrusion of your jaw, bring it forward? Okay, any pain there? Can you open and close a couple times for me? Good. Can you clench? Check that masseter muscle. Any pain, any pressure? Awesome. Okay, so I'm gonna do the ears now, okay? Oh, before I do that, let's check your sense of smell. Cranial nerve 1. I want you to close your eyes and I want you to tell me what you smell, okay? Ready? Yes, ma'am, great. Definitely cinnamon. Okay, so due to your age, when I assess your ears, I'm just gonna move your hair out the way. We're going to pull the pinna of your ear upwards and back, and I'm looking to see if you have any redness, any lesions, anything blocking your ear canal, checking for your tympanic membrane, making sure it's pearly and gray and that your corneal light is visible and in the right place, okay? You have any ear pain at the moment? Okay. And I'm also inspecting and palpating prior to looking inside and Ears are soft, no lesions noted, no mass, no pain experienced by the patient. Okay, so up and back. Okay, ear canals are clean, no masses noted. Our tympanic membrane is pearly and gray, and our cone of light is at 5 o'clock on this left ear, and we're going to look at the right side. Same on this side. Might need to turn just a little bit. Okay, same on this side. Up and back. Ear canals clean. Any pain? No masses, no lesions noted. And tympanic membrane on this side is also pearly and gray, and our cone of light is at 5 o'clock. 7 o'clock on that time, on that side, 5 o'clock on this side. Okay. So now I'm going to do a few tests to check your hearing. Okay. So first one is going to be the Ryan test, and we're looking for air versus bone conduction. Okay, and I want you to tell me when you stop hearing the vibration, when it's up against the bone, and then again when you stop hearing it just in the air. Okay, you ready? On this side. Okay. So this next test is called the Weber test. It's for lateralization, to make sure that you're hearing the same equally on both sides, okay? So again, I'm just gonna strike the tuning fork, place it at the top of your head, and I want you to tell me when you stop hearing, and that if you're hearing better or worse on either side, okay? Was it equal on both sides? Okay, awesome. Now, last test of your hearing is going to be a whisper test. I'm going to whisper 3 things to you on each side, and I want you to tell me what you hear, okay? Good. And then on this side. Good job. Good job. Okay. Any questions so far? Okay, you doing okay? You comfortable? All right. So next, what we're gonna do is check your lungs, check your chest, your rise and fall, lung sounds, percussion, your tactile firmatives, things of that nature, okay? So I'm gonna start from behind you. Oh, no, way to do your neck, I'm sorry. Let me check your thyroid real quick, okay? So I'm just palpating your thyroid gland. Okay, can you swallow for me? Okay, good. No, do you have any pain there? No nodules, no goiter noted, and our neck is symmetrical, trachea is midline. Okay, so let's get to your lungs. And I'm just having you take some regular breaths for me, inspecting the posterior chest. Okay, good. I'm going to take a listen to you. me. Deep breath in. Good. In. Good. In. Out. In. Out. In. Out. In. Out. In. Out. In. Out. Good. Lung sounds are cleared, so auscultation and all those, no wheezes, no rhonchi, no rails, no crackles noted. So now I'm just going to assess symmetry of your breaths, okay? So deep breath in for me. And out. A little bit forward. In. Out. In. Out. Good. Okay, now we're looking for tactile affirmatives. This is just feeling the vibrations in your back, in your posterior chest wall, as you say the words 99. I'm gonna have you say it about 3 to 4 times, okay? Okay, say 99. 99. 99. 99. Okay, it's equal throughout. And now we're just gonna do some percussion. Okay, sounds tympanic throughout to percussion. I'm also, while I'm back here, gonna check if you have any tenderness, CVA tenderness in your kidneys, okay? Tell me if you feel any pain. Any pain? Any pain? Okay, good. Lean forward for me. Okay. I'm gonna listen to you from the front. I'm just assessing, again, your rise and fall from the front view. Take some deep breaths in for me. Okay. Chest rise and fall is symmetry. No accessory muscles noted. No labored breathing. Let's listen to your hum. In and out for me. Okay. So we'll get you to say 99 from up front, okay? 99. 99. 99. 99. Okay, any labored breathing, any shortness of breath that you notice? Okay. So lung sounds are clear. Let me help you get your constant vertebra. Okay, cool. I'm gonna listen to your heart sounds now, okay? So I already auscultated your carotid artery, so I'm just gonna take a listen to your heart, your renal arteries, your aortic, your femoral, and then we'll get to some palpation and move forward with the exam, okay? Some of these, I'm gonna have you in different positions. So I'm gonna have you sing upright. I'm gonna listen with the bell and the diaphragm. And then for your aortic pulse, I'm gonna get you to lean forward a little bit. And then once you lay down, we're gonna check your point of maximum impulse while you're tilted slightly on your left side, okay? S1, S2. So that's aortic, this is pulmonic. Herbs, S1, S2. Tricuspid, S1, S2. Mitral valve, also S1, S2. Listen to the bell. Again, aortic. Pulmonic. Herbs. Tricuspid. Mitral valve. So I'm listening to your aortic. It's probably easier here. Aortic artery here. No thrills, no thruis, no thrills. Can I get you to lean forward just a little bit? Aortic. Okay. S1, S2 noted, and all cardiac fields. No thrills, no blues, no gallops, no murmurs noted. So now I'm gonna listen to your renal arteries, and then we're gonna listen to your femoral, okay? Left renal, no grill, no fluid. No thrill, no fluid on the right. Your femoral. We'll get right in this little juncture here, okay? No thrill, no fluids on left femoral. Right femoral. No thrills, no fluids on the left femoral. Okay, so now we're gonna do some palpation of your arteries and pulses, okay? So we already covered the carotid, all right? So now I'm gonna check your brachial. Okay, +2. +2 brachial. Bilateral radials, +2. And individually, +2. All defer the inguinal? Are you comfortable? Want to defer that one? Okay, we're going to defer the inguinal arteries. We're going to do your popliteal. These are behind your knees. Those are +2. Post-tib. +2. I'm going to check your pulses in your feet, okay? Just remove your shoes for just a second. Dorsalis pedis. That's +2. +2. And again, as I'm conducting this exam, her skin is warm, dry, intact. Hair is evenly distributed. No overgrowth for gender. No swelling or edema noted. No rashes. No hives. No lesions. No abrasions. No bruising or breaks in the skin. Okay. So I will have you come over here and lie down. I'll finish listening to your pulses, check your abdomen, and then we'll do the musculoskeletal and the neurological portion of the exam, and then we'll be finished, okay? I'm gonna have you lie down with your head on this side here. I'm just gonna adjust the camera. And yes, feel free to cover yourself. Alrighty. So again, I'm gonna listen to those cardiac pulses one more time here, and then I will have you lean over to your left side so I can listen to your point of maximum impulse, okay? Okay, pulses are all +2. Going to listen to your abdominal aorta. Okay, now can I get you to turn slightly to your left side? Just slightly. You don't have to turn all the way on your left, but yeah. Okay, bring this arm out because I have to get underneath here. Okay. Point of maximum impulse is 2+. No heaves, no lifts noted. Okay, flat on your back for me again. Okay, so I'm going to listen to your belly sounds. Vowel sounds, we're going to check all 4 quadrants, okay? And then we're going to do some percussion and palpation, and then we'll move on, okay? Okay, vital sounds are normal, active in all four quadrants. A little bit of percussion. Okay, any pain or pressure noted there? Okay, so light palpation. Any pain, pressure? Okay, so I'm gonna go a little deeper. So I'm gonna be checking for organ placement as well, okay? But you tell me if you feel any pain or pressure with. No pain or pressure with deep palpation. Because for liver. So liver is about 7 centimeters in span and palpable. See if I can palpate the spleen. Spleen is not palpable. I'll palpate for the kidneys using the duckbill technique. Kidneys are minimally palpable. Okay. I'm gonna have you come sit up for me. We'll assess some. You can have a seat back in a chair. We will assess some neurological reflexes and then musculoskeletal. But before we do that, I did forget one thing, and I also check your oral mucosa, okay? So, and this is just palpating inside, okay? So, lips, pink, moist, no lesions, no masses noted. And I'm just gonna palpate there. Any pain, any pressure, any pain, no bleeding or pain in the gums. Okay, and floor of the mouth. Any pain, pressure? Okay. Thank you. Okay. Can you tell me where you are? Can you tell me what year we're in? Can you tell me who the president is? Okay, good. I'm gonna tell you 3 words, and I want you to recall them when I ask you, okay? Money. Bus. Candle. Okay? Alright, so we're gonna check some reflexes. So I'm gonna start with your bicep reflex. Can you flex your arm? Alrighty, feel for that bicep tendon. There you go, relax it. And okay. Tricep on this side. Okay. Brachioradialis. Good. Same over here. Bicep. Relax. Good. Tricep. Good. Brachioradialis. Okay, then we're going to check your patellar and your knees, so relax your legs for me. Okay. please. Seven. Okay. Leave on this side. Alright, can you tell me what 3 words I asked you to remember? Great. Your recall is very good, okay? So now I'm going to check sensory, and I want you to close your eyes. Oh, we didn't turn the camera back. So let's do the reflexes again since the camera was not in view. Okay, you can see. All right. Bicep reflex, tricep, brachioradialis, bicep, tricep, brachioradialis, okay, patellar, next, patellar, Achilles, Achilles, okay, deep tendon reflexes within normal limits, 2+ bilateral upper and lower. I want you to close your eyes for me, and I want you to tell me whether you feel sharp or dull, okay? Okay, so musculoskeletal. All right. So I'm gonna have you push up against. We're gonna check your knees and hips. Really, push up against. Like lift your hips up. There you go. Pull them down. Okay. Straighten your knee out. I'll pull back. Okay. Push out. Pull back. Push out. Put your ankles. Raise them up. Don't allow me to push it down. Push down against my hand. Raise up. Don't allow me to push it down. Push down against my hand. Which way am I pulling your toe? Down. Wiggle them for me. Good. Okay. So watch your shoulders. Push up against. Good. Turn your head against my hand. Good. Against. Good. Okay. Hold your arms out. Don't let me push them down. Don't let me pull them up. Bring them up like this. Don't let me pull them out. Don't let me push them back. Okay. Grip. Squeeze as hard as you can. Wiggle your fingers for me. Need your wrist up, down, out, in. Any pain when you do that? Flip them up. Up, down, up, down, up, down, fast as you can. Rapid movements. There we go. Okay. And with your, you can stop. Flex your ankle up, down, out, in. Now roll forward, like that. Don't bend your knee. Just roll your foot forward. Now roll it out. Okay, same thing. Up, turn in, turn out, rolling, roll out. Okay, good. So I'm gonna check your spine. Can you stand for me? Turn facing. All right, so we're gonna check if you can bend your head to your chest, chin to your chest. Okay, deflection, extend all the way back. Side to side, straighten up, side to side. Ear to shoulder, ear to shoulder. Okay, can you turn side to side? Yeah. Okay. Can you bend over, touch your toes? So while you're doing this, I'm checking for straightness. Make sure you don't have any scoliosis of your spine. Okay. Alrighty. You can stand back up. Okay. So next I'm going to check your gait. Okay. Well, before we do that, check your gait. We're going to turn. Turn at your hips, at your waist. Turn. Other way. Okay. Now can you lean side to side? Okay. Okay. And come back as far as you can. How's that? It's okay? Okay. All right. Now we can check your gait. And for the sake of time, I'm going to have you walk normally to the end of this carpet and back to me. Walk. Okay. Gait is steady and smooth. Come on back. Okay, I need you to do that on your toes. Do it on your toes. Good. Now can you do it on your heels? Good. Now can you do heel toe tandem? Heel toe, heel toe. Okay, good. Balance is good. Okay, now come back to me. I need you to put your feet together. That's it. Put your feet together. Head straight. Eyes closed. Keep balance. Okay. Do you have any questions for me? I think you did great. Everything looks well. Again, thank you for coming. I appreciate your participation. And this is the end of our exam, okay? Nice to meet you.